BioBalance Healthcast 122, Celiac Disease and Gluten Issues.
BioBalance Healthcast features conversations about positive aging. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor.
Recent information in the New York Times contained an article about gluten problems and celiac disease. And in the article, they mentioned that while there's a lot of confusion about where does it come from, what causes it, how do you treat it, how do you have it, what they are certain about is the exploding frequency of it. Mm-hmm. In the last 20 years in the United States, people that suffer from various intensity levels of gluten disorder have increased in number by 40%.
Well, let's talk about what it is.
Let's talk about what it is. Let's start there.
Let's start with what, if you've never heard about celiac disease, it sounds really onerous because it's a weird name, but celiac refers to the intestines. Mm-hmm. Okay, so this is an intestinal illness that causes bloating, diarrhea, malabsorption, like you eat great stuff, but it goes right through so you don't absorb it, and abdominal pain, and several other things. But it is something that we've had around for many years, but there wasn't a test for it until about 10 years ago, which means that's why we have an increase in numbers. Now,
so we're doing better diagnosis, or at least one potential explanation is we're doing better diagnosis as opposed to exploding level of frequency.
Yeah, and so that's always an issue. If you have, when we started looking at bone density for osteoporosis, all of a sudden the amount of osteoporosis was huge because we had never really tested for it. We looked at people and thought, well, she looks like she might have it, and maybe if she broke a bone or two, then we'd say, well, maybe she has it. But we didn't have a machine to test it. Once we did, then the number of cases went up, and we were able to test it well and accurately.
Yes.
So there's a lot of bowel diseases that cause diarrhea, that cause abdominal pain. There's a lot of wastebasket terms, kind of called IBS, like irritable bowel syndrome, which is usually constipation and diarrhea, but can be just diarrhea, where people were told that's what you have. But now that we have the test, we can look at it, and we've researched it now and found that it takes two things. To have this autoimmune, or it's an immune disease, we are attacking our own intestinal wall. Okay, so we have found that our body's confused. It looks at the lining, which are little villi. They look like little fingers, and that improves our absorption of food. It looks at those villi and it goes, that's a foreign body, that's an illness, I'm going to go attack it. So we actually attack our own intestinal wall. That's the type of disease it is.
The villi are like hairs,
They're like little
that
hairs
come out from the wall of the intestines.
Yes, and they increase the amount of surface area that you can absorb things.
And our immune system suddenly recognizes that as the enemy, like it does with an infection.
Right.
And it begins to attack it.
Yes, that's right. And so
what makes that happen? Do we know?
Well, there are, in this article, it confirmed or researched basically what doctors know, and that's that there are genetic types.
Okay.
And the genetic types have to do with the type of white blood cell you have. When you're HLA typing is what they look at. There's two different HLA types for people who get celiac disease. HLA is the type of white blood cell. It's what we look at when we're going to see if, like, my kidney could be transplanted into you. We look at your HLA type and my HLA type, and if they are compatible, then we can.
Or a stem cell transplant or something like that?
Or
is that the same?
Well, stem cells don't have an HLA type because they're stem cells.
Right.
But other kinds of transplants, bone marrow transplants, but not stem cell transplants,
right.
would have the same issue.
Okay.
But when we're looking to see if we can transplant from one person to another, a compatibility, we look for HLA typing. Well, they found that everyone with celiac disease has one of two HLA types.
Okay.
But not everyone with those HLA types gets celiac disease.
Right.
Like most things, you have a genetic weakness, and then if you're exposed to something, and it's not just gluten, but if you're exposed to gluten for sure, then 10%, 5 to 10% of the people that have that HLA type will get celiac disease, or the symptoms of it, an attacking of the cilia, diarrhea, abdominal pain, poor absorption, even it causes malnutrition.
Because you're not absorbing the nutrients that you need.
Right,
Because
in your
your
diet.
intestines are under attack by your own immune system.
Yes.
So
Yes.
this article says that 30% of the people with European ancestry have this genetic predisposition to potentially have this happen.
Right.
But that 95% of that 30% never have a problem with gluten, wheat, digestion,
True.
and so on. So the 5% that you were just mentioning are at risk. And the secondary question then becomes, if you have the genetic predisposition, what is it that triggers that action?
That sensitivity to gluten.
If 95% of the people don't have a problem, even though they have the genetics to allow the problem, then what is it about those 5% that causes them to develop the problem? And in reading the article, it seems like they suggest there's a combination of about 5 factors, and they're not real sure about what the relative weights of trigger mechanism might be, but they think that it's some combination of these 5 things.
Now let me just give us some backup before we go into what those things are. Your intestines actually have to have really good bacteria in it. We have good bacteria and we have bad bacteria, and they live in a state of détente. They're working together and they're not taking over one another. They've formed a balance.
So there are good bacteria.
Yes,
And
and
then there are
bad
And
bacteria.
bad are what we call infections?
Right, and bad bacteria are like E. coli, but you have to have them.
You have to have some.
You have to have some, but if they overtake the
It's
intestine,
got to stay in the box. It's got to stay where it's supposed to be.
They
Yeah.
can't be overwhelming one another. So that's
Right.
why I called it détente. They're
Yeah,
kind of like
exactly.
they're balanced. So
There's a war going on.
there's a
in
war
your
going on
intestines.
in your intestines between these two bacteria and
The White Army and the Brown Army.
yeast. Stop. Okay. And then there's yeast as well. And yeast has been posed as something terrible, but it's not terrible unless it's not in a state of balance. So yeast, good bacteria, bad bacteria. Okay, you've all heard of probiotics. Probiotics are the good bacteria to balance out the bad bacteria. Okay, so what happens is you're living in this perfect balance. Then you take an antibiotic, and it may kill the good bacteria while it's trying to kill bad bacteria on your body, and then that balance is imbalanced, and you get diarrhea, or you may not be able to control your stools because the good bacteria was killed. The bad bacteria gives you diarrhea.
So your system
pain.
was working and malfunctioned in a particular way. And there's a medical intervention to stop that specific malfunction. So they give you a drug for that. But a secondary negative aspect of that drug may be that it turns off some other part of your system.
Right. Well, it kills the good bacteria. Any
Which
antibiotic
allows
might kill the good
bad bacteria to
Right.
go rampant.
So my answer to that is every time you take an antibiotic, then you take probiotics during and after to replenish the good bacteria.
Okay, so because I'm
So-
ignorant, what are probiotics and how do you take them? Are they pills? Are they
probiotics,
liquids?
you can take them as like in a milk. They have milk. They have milk with probiotics. They have yogurt with probiotics. They have it's good. It's lactobacillus and other bacteria, acidophilus.
That's added to the substance.
That's added to that food that you absorb and help fight the bad bacteria and regain your balance.
Okay.
Okay? So this is how your intestines work every day without you thinking about it.
I don't spend a lot of time thinking about
I know, and you shouldn't. You shouldn't unless you have an imbalance and you have something go wrong with it. So now just consider that system. Everything's all balanced, and the way we get bacteria into our intestines is that we live in this world. There's bacteria all over our skin every day, staph and strep, and our body is able to fight it off, and it's able to live in kind of a balance on our skin. The only time we get infected is if we have a cut and it gets under the skin, or we have our immune system drops and we can't fight it.
So are the bacteria that are in the intestine a more virulent strain, a more deadly strain, a worse degree than the kind of bacteria that would be on your skin
No.
or they're on the table?
No.
They're similar.
They're similar. It's
Okay.
just that they're under control in both places because of your immune system and because of the other good bacteria. So we're talking about when I was in college, I had this like globe and we had this little mini environment, okay? And do you remember growing like little ferns and things? And it was all,
Yeah, they had 5 leaves and they were green.
that's not what I grew. Anyway, that may have been you. In any case, the oxygen and the carbon dioxide had a balance. It was all in the system. Well, that's your intestines. And while you were growing up, mud pies and playing and getting all this bacteria from your environment into your intestines basically is how we got our immunity and how we like funded our bacteria.
I remember having discussions years ago when our children were young with parents who were like what we call helicopter parents today, hyper-vigilant, hyper-perfect. They can't have red dye number 2, and they can't have sugar, and they can't have this, and they can't get dirty. And my response was, kids need to eat dirt. Kids need to get dirty.
Actually.
Kids
I
need
mean, here's a doctor telling you that your kids need to get dirty. They need to have microbes. In underdeveloped countries where there's all kinds of bacteria everywhere and it's not a clean environment, much to the opposite of what we have, and not healthy either. But people don't get the same diseases as we get because we're not introduced to all of this. We're kept sequestered by our parents. Usually the first child in a family has the most problems with their intestines and has the most problems with their allergies and autoimmune systems because
they treat them
mom
like porcelain.
was hysterically clean.
Yeah. Oh,
and was sterilizing everything. And I mean, I'm not saying you should be dirty. I'm saying too clean is just as bad as not clean enough. There's a medium. Everything is about being in the middle. So this is how we get our good intestinal flora.
One time I was babysitting a kid next door.
Okay.
He was maybe 2.5, and his mother was gone. All the women were gone. I had this slew of kids, and he had to go to the bathroom. So I had to help him. And sitting on the table next to the toilet were some sanitary wipes. And so I cleaned him with the sanitary wipe. And about 5 minutes later, my wife got home, and I'm saying, giving her the report, okay, this happened, and Ethan had this been, and she said, you used those wipes? And I'm like, yeah. She said, oh my God. So she runs and grabs the kid and takes him in and cleans him all over again. Apparently I had used a wipe that had like Purex in it. It wasn't one.
It was to clean the bathroom, not to clean the baby.
Toilet. It wasn't to clean the baby. she was hysterical because I killed all his bacteria and also burned and blistered his skin. And so
Did
his
you
mother,
really? Did it burn his skin?
No, it didn't. I mean, she got him in time. But she said it would have, and I take her word for that.
Yeah. I believe her.
I believe her.
Yeah.
I always believe her.
Yeah, of course you better.
Yeah. But I use that as an excuse, and there's a thing in sociology we call creative incompetence. So after that, I was not competent to wipe babies' butts anymore.
That's
so
good. So you got out of it. Okay, so we're back to celiac disease. So now we understand that we are in this beautiful balance and certain things interrupt it.
Harmony.
So now we're talking about the things that you can do to prevent or deactivate this autoimmune disorder, prevent the disorder, right?
Right.
So you have celiac disease. It is an autoimmune disorder. It takes this HLA type plus something else. And what is that something else?
Well, the article talks about something called a bifidobacteria. Are those the...
I can tell you that's a new term.
Bad
Yeah.
bacteria?
Yeah, that's
like
bad.
E. coli that's in your
Right.
system? But it says that from research that's coming out of Russia that you need those microbes and that bifidobacteria to maintain that balance, and that for those people who have the balance because they have those bacteria, even if they have the genetic marker, they're in that 95% that don't get celiac disease.
Right.
So we're back to the
To
five
the balance
things,
of the,
and
okay.
one of the 5 things is that you need the balancing amount of the proper amount of exposure to microbes that are generally thought of to be bad bacteria. So you need an environment where those things are prevalent or available, where you encounter them, whether you consume them, where you exist.
Living in a bubble is not good.
Living in a bubble
Because
is
when
not
you come
good.
out of the bubble, everything attacks you. Your immune system isn't ready.
Okay, so we have 2 of the 5 things then. We have the microbes, the bifidobacteria, which is a new term, and we have the environment. You need an environment where those things are in the environment. Kind of like we did a podcast a few weeks ago about being in an iodine sink. That's part of the environment. You need that in the environment in order to be healthy. And
Having iodine in your water and everything else, yes.
yeah, okay. So then the third thing they talk about is breast milk.
Yeah.
And the data in the article suggests that those children in those environments where those microbes are present who are breastfed have less problems later in their life with celiac disease. And so one of the recommendations, and at this point, we still don't know which is cause and which is effect, which is trigger and which is happenstance. But they're saying we know all of this is in the mix. And so,
But we haven't determined how much of it, how much weight it carries, because some women just can't breastfeed.
some can't.
And
Some cultures don't.
And the study didn't separate babies who had breast milk out of a sterile nipple versus breast milk out of a colonized skin of the breast, because on the breast there's bacteria.
Exactly.
So they didn't separate those two. So is it the fact that the baby's breastfeeding from skin that has flora on it, normal body bacteria, or is it the breast milk? I think it's a combination of both.
So does the La Leche League recommend sterilizing the nipple if you're breastfeeding? Do they recommend that you use those kinds of cleaners? And I mean, we're
recently, since I don't do OB anymore,
Yeah.
I haven't really.
Or do they
I
just
haven't
figure
really-
that the bacteria of the mom's body and the baby's body are so interconnected at that level, and the newborn has
They
the
recommend you
protections?
breastfeed anywhere, anytime, all the time, so you
I
can't
understand
sterilize
that
your
they do-
breast.
Well, but you can wipe them with a.
Towelette or something.
Yeah.
I've never seen that in the recommendations, but I could
That's
be
what I
wrong,
was
so
asking.
I don't want to say
And
that I
it
know.
was a legitimate, serious question, not a cutesy question.
I know.
I
I
don't-
understand. But the other thing about breast milk that I didn't say, and I'm not trying to dissuade anyone from breastfeeding, God forbid, but in that first several weeks of breastfeeding, there are live cells, live immune cells that are transmitted from mom to baby.
Right, from the
And
mom's immune system.
From the mom's immune system through the breast to the baby, that then colonizes or helps the baby fight infection for over 3 months.
Okay.
So it helps that 3-month thing. We don't know how long it works.
Okay.
But it's going through the intestines.
But it continues to protect him, just like being in the womb protected him, until
Right.
his own system comes online.
Right. It's a protective process.
Okay.
It doesn't take 6 months of breastfeeding. It takes a week to 2 weeks of breastfeeding, but that's also, I don't want people to go, oh, 2 weeks is enough. It may not be enough for you. It may not be enough for your baby. Breastfeeding is considered preferable both for bonding and if you enjoy it, then for you as well. For
But there
as a
are
woman,
some
that would be
unique health conditions for women where breastfeeding is contraindicated.
right. And if they're taking medicines or if they have an infection of a red swollen infection of the breast, then they are not to breastfeed.
Right.
From that breast, at least, they can breastfeed from the other breast. If they have a fever, they're not to breastfeed from either breast.
Okay.
Because then whatever's in their blood is going to the milk. But it is both the live cells and the IgA. Do you know what IgA is?
No.
Ig is an immunoglobulin. IgA is an immunoglobulin that covers the intestinal tract, and it keeps your intestinal tract healthy and able to protect you from the environmental bacteria.
And that's in the breast
And
milk?
that's in breast milk.
Okay.
So that's
And so
not.
if you get it for 2 weeks, breastfeeding, and
But the
you're
IgA
disclaiming that
lasts
2 weeks is-
longer.
That's what I want.
IgA lasts longer. The live cells only last during the colostrum period.
Okay.
But the IgA lasts longer, and I can't tell you how long it lasts, but it does last longer, and it does protect children from illness, especially in the first 3 months, but we aren't sure how long it protects them, and
Right.
it may even protect them from celiac disease.
Yeah.
Now,
It may move them into that category of the 95%.
Right.
And we just don't know enough yet to know.
right, but there are other factors. You could be like, I know people who are breastfed
Uh-huh.
who have celiac disease.
Yes.
So it doesn't complete. It's not 100% protective.
Well, but it's these other factors, and the last one we haven't mentioned is antibiotics.
Right.
The existence and prevalence and types of antibiotics.
And I'm an advocate of antibiotics. I believe
Right.
people believe when somebody's sick, you don't wait till they get deathly ill to start antibiotics.
Right.
If they have something that needs an antibiotic and they have a bacteria, I believe that they should be treated. However, you should always then repopulate with
the probiotics.
Acidophilus, Lactobacillus, or they even have gummy bear probiotics now that you can give to children, or if you hate swallowing pills or hate this other stuff, you can just chew a little gummy bear. You can get them at Walgreens. And you can take that either every day or you can take it during the time after you've taken antibiotics. It's awesome. We've got everything now that 10 years ago we had to go look to a health food store for. So we can really use antibiotics, but we have to repopulate our intestines to protect ourselves. Mm-hmm. Now the intestines are also, believe it or not, the source of our neurotransmitters, like serotonin that makes us happy. Mm-hmm. We make serotonin in our gut. So if you don't have celiac disease, or if you have celiac disease, you are not making serotonin. You make dopamine in your gut. You make immune globulins in your intestines. All of those things come from our intestines. It is so important to control celiac disease if you have it.
Yes.
Otherwise, the rest of your body falls apart.
It's a real serious illness, and people that suffer from it suffer not only discomfort from it, but serious health risks arise.
Yes.
And it is a concern, particularly in the United States, because in the last 20 years, people that have been diagnosed with it, who suffer from it, the population of that group has exploded. And we don't know exactly yet what specific triggers, in what combinations, what switches throw to make it. We can identify that you're at risk because we can do the
HLA typing.
And
a GI specialist or a geneticist would do that. You would go to your GI doctor or a geneticist.
Yes. And then if you have it, it's not the same in intensity for everybody.
You're right.
There's a continuum of severity that you may suffer from.
And the first line of treatment to start with is to take gluten out of your diet. And you literally have to get a book to find out what has gluten in it, because some wines have gluten in it. Things that have nothing to do with wheat that you would think have anything to do with wheat. I picked up an oatmeal bread. I try to limit gluten just because it actually doesn't make me feel great, but I don't have celiac disease. But I try to limit. I picked up oatmeal bread. The first ingredient is wheat and gluten.
Wow.
In oatmeal bread.
Yeah.
So oatmeal bread doesn't mean you're eating
oats.
oats.
Really carefully.
Yeah, you have to look carefully at your
most
food.
grocery stores now have, because of this increased prevalence, most large grocery stores will have a gluten-free section where you can get pastas that are made from rice, or you can get breads, or you can get cookies and cake mixes and so on.
I'm Sicilian. I still have to eat. That's my one guilty pleasure, is I have to eat pasta, even if I don't eat bread. I've got to once in a while have some pasta that's
But you're a
made with
non-celiac Sicilian.
Yeah, I'm not celiac.
That's
but
alliterative.
yeah, it's still, it's still a carb.
Oh, yeah. Yeah. Oh, I hear you.
It's still a carb and it's still fattening, but, and it's still flour.
Yeah.
It's a little less aggressive as wheat. Semolina flour is just a little less irritative to the intestines for anybody, but it's still, for people with celiac disease, they can't even have that. So I don't recommend it. But there's a book about, basically, Wheat Belly is about celiac disease.
The name of the book is Wheat
That's
Belly.
the name of the book.
Yeah.
And it's by a physician. And he wrote a lot about the prevalence of wheat in our diet and how much we have wheat in our diet because we grow wheat in this country. And there's still some question about whether it's a change in the wheat or it's a change in our activity level, or if it's a change in our immunity, why we have it. He introduces other questions, but this is from the New York Times, in the I think end of February, New York Times.
Yeah.
So if you're interested in that, I love the New York Times because I love the way they write. They just have such great writers. But when they're talking about medicine, their research is really good. So I really enjoyed the article, and I thought it would be wonderful for us to discuss it because it needs a little more explanation even than they gave.
And it is more prevalent, but there are identifiers that can let you know your risk level, and there are treatments.
There are tests.
Tests that can be run, but also the market is beginning to fill the gap in terms of saying, well, if you can't eat wheat, you can eat these other things, and then you're not as malnourished, and you're not going to starve yourself to death.
Right, and you're going to absorb all your other vitamins and minerals.
Right, which you need to be able to do.
Yeah.
So if it's something that you or a friend of yours suffers from, do the research and find out, and rest assured that medicine and science are working on it.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. You can find Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth. Find Brett Newcomb at brettnewcomb.com.